Are there allergy tests that are better than others in checking food sensitivities? Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello, and welcome to Digest This. I'm Dr. Liz Cruz, and I've got Tina Nunziato sitting right here by my side. If you're watching on YouTube, you will actually see her.
Yay!
See us.
And her.
That's right. So welcome. If you are one of our regular listeners, we are so grateful for your loyalty to this podcast and being on this journey with us. Every day is a new day. Every podcast that we do is something different. Sometimes it's a similar topic to one maybe we've done in the past, but we try to, do a little spin-off and do a little something different about that topic. And those of you that are listening for the first time, welcome and thank you again for taking time out of your schedule to listen to us. So let's go ahead and jump in.
Yeah.
So this is actually a topic that we did do back in 2018. So we've got hundreds of podcasts in our library. You can go back and listen to any of those podcasts. And there are a lot of great topics. We did talk about allergies back in 2018. And so we want to come back to that and maybe talk about a couple different things about it.
Well, we've had a lot of patients do that test since,
absolutely.
From that podcast. And then we've got a lot of patients asking questions about that test. And we tend to get the same questions over and over again. So we thought it would be good to do a podcast where we answer those questions.
That's right. And if you listened to last week's podcast, those of you that are listening every week, and if you didn't listen, please go back and listen to last week's podcast. We'd actually been off the air for several months, and we go in a little bit into why on that podcast. But towards the end of the podcast, I was telling Tina that recently I had told our nurse practitioner that when we see our patients in our office, typically we end up scheduling them for tests because they're coming into us because they have different gastrointestinal issues, unless they're coming in for a screening colonoscopy, which most of those people that are coming in for that don't have symptoms. But we have, by far, the majority of the patients that come to us do have issues. They have reflux, gas, bloating, constipation, diarrhea, abdominal pain, bloating, which I already mentioned, but we just see it so much. And so we end up working them up. A lot of them will end up doing procedures like a colonoscopy or an upper endoscopy to look in their esophagus and stomach. A lot of those people end up getting both of those. They'll get ultrasound, CT scan, MRI, blood work. I mean, you name it. We try to do a full and comprehensive, complete workup on them because our goal is to rule out bad stuff, okay? We're trying to figure out what's going on with them, and rule out something bad like a cancer. And so we do this full workup. And, and in the end, when I go and talk to the patient at the end of their procedures, what they want to hear is that everything came out good. Okay. I mean, obviously a lot of them want an answer, but if the biggest thing is coming out and saying, you know what, overall things look good. There's no cancer, nothing that looks worrisome. Sometimes they do have inflammation and we do biopsies to see if they have infection, see if they have celiac disease. If they have diarrhea, we'll do biopsies in their colon to rule out microscopic type of inflammation. So, we're trying to just rule everything out. But in the end, if we end up ruling everything out, what I told Maureen that what these patients need is, number one, a lot of love. That's where we start bringing them in and doing nutritional consult and maybe there are things in their past, stressful, traumatic situations that happened where they just need us to listen to them. So they need love, they need probiotics, digestive enzymes, which we're very big on, detox and greens, and they need testing for allergy sensitivities, and for food sensitivities and allergies. Yeah. And so
most of the time, you were referring to allergists.
Yes,
right? We refer to allergists mainly because insurance will cover
Absolutely.
a trip to the allergist and a bunch of allergy testing. So that was typically and that's what you'll get from most gastroenterologists that are going to refer you out. They'll refer you to an allergist.
Exactly. And we do refer out. We refer out to allergy specialists for different diagnoses, depending on what the diagnosis is. But I wanted Tina to talk a little bit about we have an allergy test that we offer. It's a kit that tests for like 140 different food sensitivities. Is it okay for me to say food allergies?
Yeah, I mean, it is more food sensitivities.
Okay.
Typically a food allergy, you're reacting as soon as you eat the food, right? Like your throat is swelling up, or your tongue gets big, those types of things. You get inflammation. Sometimes we have a sensitivity to a food really, really deep in the body. And it's more of where you're not going to feel that for like 2 or 3 days later.
Okay.
Right? So sometimes the issue with sending to allergy testing is that, like, typically an allergist is going to do a skin prick test, or they're going to draw blood, right?
Okay.
Those are the typical tests that they have available to them. And the skin prick test is really good for testing environmental allergies, right? Like dirt and trees and grass and things like that, pollen. Yeah, but it's not great at getting to food. Okay. If you have food that comes out on your skin, then you have an allergy to that food. That's like really, really
So
bad.
if the allergy specialist, if it comes out positive on their testing.
Yes, exactly. Then that means you definitely need to stay away from that food. But you might have a sensitivity to a food that doesn't come out in the skin. Okay. So that's what we're trying to get deeper into the body.
Like more to the cellular level?
Yes, cellular and tissue level is where you really want to get. And just the tests that they have available to them they're not getting to that level, right?
Okay.
And it's the way I try to explain it to patients is having the kit that we have comes from a company called US Biotech, okay? And like you said, it's tested 144 foods at what's called the IgA-IgG level, which is the cellular and tissue level of the body, okay? And the way I explain it to patients, it's like the difference between going to a traditional allergist's office versus a holistic or more naturopathic doctor's office. The more naturopathic doctors are going to have these deeper tests. And the reason why traditional allergists, regular MDs don't have these tests is because they're not covered by insurance. That's the big crux of the issue is here. It's not that an allergist doesn't want to offer these tests, right? It's just that insurance won't cover it. Most people aren't willing to pay cash for these things, so they don't offer it, right? And a lot of them probably don't even know about these tests, honestly, because the main tests that are shoved down their throat are what LabCorp and SonoraQuest are offering for allergy testing, right? And it's all they know. It's how they've been trained. This is what we order, right? So it's not, it's not their fault, right? And it's mostly the fact that insurances aren't covering these tests. So naturopathic doctors will typically offer these tests and people will pay cash. Because if you go to see a naturopathic doctor, most of that is not covered by insurance, right? You're paying cash for the doctor visit, you're paying cash for your supplements, you're paying cash for your testing, okay? So the people who go to naturopathic doctors are just expecting that they're going to pay cash. So they have access to these tests that are a little bit more detail-oriented for getting results to patients, right? Because I think the most frustrating thing for a patient is to have all this traditional medical testing done and everything comes back negative. And they're sitting there going, oh no, or the doctor will tell them, oh, well, everything's good, so it must be in your head, that you're having these issues. And, people don't want to hear that. They know they don't feel good, right? And they should know they should listen to their body, right? Yeah. So there is something to be said for there are tests that can get deeper than what traditional medicine is offering today. Okay. And so it's what we're trying to do is educate patients that those tests exist and give them the option to take advantage of those tests or not.
So this test that we offer is probably going to pick up more sensitivities to different foods than the traditional tests that they would get done at an allergist office. Is that correct?
Yes.
I mean, so basically kind of what I'm hearing is that if the testing that is done at the allergy specialist office picks up a food allergy, then it's a pretty serious.
Yes.
I mean, it's a definite.
Yes.
So does that mean that there's a possibility that it may not pick up just mild sensitivities?
That's correct.
Okay.
Yes,
Okay.
it will not. So I have a lot of people who've gone to see the allergist already, and they'll tell me, oh, they just picked up that I was allergic to corn. Okay. Then they come in to us, have this US Biotech test on, which is basically a finger prick test. So they prick your finger. You can either do it yourself or we could do it on you. We prick your finger, we put the blood on a blood spot card, and we send it in. And all of a sudden, 15 sensitivities come back, right? Dairy, grain, maybe it's wheat, whatever. And they're like, oh, well, the allergist didn't pick this stuff up. And it's because it's so deep that this test is getting that it's triggering your body being sensitive to it at the deep, deep, deep level. And so, again, this is like a wake-up call for a lot of people because most of the foods that pop up are foods they're eating every day. And that's the thing, that's where I try to educate patients about leaky gut. I mean, we could do a whole podcast on leaky gut, okay? But if you start having digestive issues and you don't get them resolved, they're just going to get worse, honestly. What happens is the gut just gets sicker and sicker and sicker if you don't fix the problem, okay? So over time, what starts to happen is as you get sicker and sicker, there's going to be more foods that you become sensitive to. So I can tell by the results of a blood spot test how long this person has had digestive issues, based on how many food sensitivities have come back, right? So what we try to do is, one, it's a wake-up call for them. They're like, oh, okay, this is good to know. Now I can stop eating, these 10 foods or whatever. We make sure that we have them on enzymes and probiotics for sure so that we can start repairing the damage. And by keeping them off of those foods for at least 6 to 9 months, and then getting them to take enzymes and probiotics, they start to feel better. And usually by 6 or 9 months, they're at a point where they're not having digestive issues anymore. So then what I tell them is we can do the test again. And what we notice is that a lot of those food sensitivities decline. So maybe if they were allergic to wheat or gluten, all of a sudden now it's gone down. And now they can start reincorporating wheat and gluten because the leaky gut has healed, right? So we're not allowing things to pass into the body anymore to cause these reactions. So it really is really cool.
That's incredible. And can these people eventually go back to these foods or some of the foods?
Yes, sometimes. Again,
so how do you get them back on? How do you do it? I mean, I know how I've done it traditionally. What do you typically do with our clients, our patients that are doing, the nutritional and getting on enzymes, probiotics, and how do you guide them through that?
Well, we say, if you're feeling better at the 6 and 9 month mark, we can do the test again. If the test comes back and everything's less, then I tell them, okay, you can start reincorporating. I wouldn't do it every day, right? Do it in moderation, maybe 2 or 3 times a week at the most. Make sure you take your enzymes when you're eating those things and see how you do, right? Do you feel okay? Even up to 2 or 3 days. That's why I tell people don't eat it every day.
Right.
Eat it on a Monday, still see how you feel through Thursday, right? I mean, do you have a reaction are you having pain on Wednesday? You can absolutely, have reactions, gas, bloating, days later if your body's reacting to it. So I just tell people, pay attention. You know what feels good. You know what doesn't feel good, right? So, we've had success with patients getting back on some of the foods that they had sensitivities to.
And being able to eat them on long term where it doesn't cause them issues.
Yes, as long as the gut is now healed and, we're not dealing with the leaky gut anymore. But we also have had patients who they feel better and I do the food sensitivity test and those sensitivities stay there. And I tell them, look, your body just doesn't like those foods. You need to stay away from those foods. So it really just depends on the person. Everybody is unique in that way. Just having the answer is so critical. Again, we've had patients who have been through so many doctors and so many tests and everything comes back negative and they're so frustrated. And then they do this test and they're like, finally, I have the answer, and if I can just stay off these foods, I'll feel better. Yeah. It's huge.
It is. It really is.
And so many patients who just don't, because the test is expensive. Okay. I'll tell you, it's $389. So it's not cheap. Okay.
So it's truly an investment.
It is.
That you are making in yourself.
But I will tell you, for the people who get the answer, it's worth every penny.
Yeah.
Okay. And I've had so many people who come to me and, they've been on enzymes and probiotics and yes, they're feeling better, but they're still having these issues. I always tell them, you have to do this test. Oh, I don't want to spend the money. Oh, okay. Well, then you're going to be living with this issue because there's obviously something you're eating regularly that's causing you to have these issues, right?
Right,
I mean,
right.
everything goes back to something. There's always a cause. People are like, they always want the answer, but a lot of people are like, I don't want to invest in the test. And I'm like, well, then, you're going to be stuck. Right. So
once they do the test, how long does it take to get the results back?
usually 2 to 3 weeks.
Okay. And then usually you'll set up a call with them and go through everything, walk them through.
Yeah, the results come back to my email. I forward them the email with the report, and I just say, let's schedule a time to go through it.
Cool.
And we do, and then they have the report, you know, that they can share with anyone. It's their report, so they can share it with anyone.
And I wanted just to real quickly, we need to start wrapping things up, but I wanted to quickly talk about allergy versus sensitivity. Because like you mentioned earlier, allergy, a true allergy. I mean, you're going to have probably some swelling, shortness of breath, maybe even breakout in a rash, hives. Whereas sensitivities, which I would say is a majority of what we see, people coming in with sensitivities where when they eat something, they get bloated, they have diarrhea, they have gas, it worsens their reflux. I mean, those are signs. I mean, once we've ruled out the bad stuff, signs that, there's some sensitivities floating around in their body. So anyways, anything else that you want to say? I mean, this is great.
No,
great
that's it.
information.
Just to educate people that these tests are out there and to let us know if they want to take advantage of them.
Perfect.
Yeah.
Perfect. Awesome. Well, I hope that you enjoyed this. I truly enjoyed. I always enjoy listening to Tina and very, very great information. And thank you so much again for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.